Welcome to Indiana News Desk. I'm Joe Wren. New Governor Eric Holcomb promised in his State of the State address to make it easier for counties to establish syringe exchange programs, and a bill moving through the legislature would make that possible. As Becca Costello reports, the programs aimed at reducing the spread of HIV and hepatitis C still face significant opposition.
Hepatitis C cases in Tippecanoe County have been increasing about 30% each year for the past 3 years. Health officials have been working on a syringe exchange proposal for more than a year. County commissioners approved the plan last November, and the state health department approved a month later. But the program won't be ready to open for at least another few months.
There's a lot of different parts, and trying to make sure all those parts were met to have the state approval for their syringe exchange program was a daunting task and some people were kind of scared of that process here.
An unprecedented outbreak of HIV cases in Scott County 2 years ago marked a change in how state officials addressed the state's drug epidemic. People here were sharing dirty needles to shoot up powerful prescription painkillers. Then Governor Mike Pence approved a bill that allowed counties to establish programs where intravenous drug users could turn in used needles for clean ones. But counties have to get state approval before they start an exchange.
We have heroes on the front lines saving lives every day. They include the public health nurses who run syringe exchange programs in 9 Indiana counties. And that's why we will give county officials authority to establish syringe exchange programs to ensure that the people making the decisions are those closest to the problem.
House Bill 1438, authored by Republican Cindy Kirchhoffer, eliminates the step that requires state approval. It has bipartisan support, but does face significant opposition from new Republican Attorney General Curtis Hill. Hill testified at the House committee hearing, saying syringe exchanges encourage drug use. But the Centers for Disease Control and Prevention says that's not true, and they encourage the expansion of the programs nationwide.
It seemed like he wasn't really aware of the research and evidence that's out there that is not true. In fact, it reduces the harms associated with injection drug use.
But Attorney General Hill isn't alone in his concerns. Back in Tippecanoe County, progress is slow because of local opposition.
A lot of people don't understand exactly what a syringe exchange program is. They just think it's giving people needles and then you're condoning drug use. But
Hostetler says the programs offer a lot more than that. Overdose intervention drugs, health insurance help, referrals to addiction and mental health counselors, help with transportation, food, immunizations, and vaccines. The programs will offer STD testing and condoms, and all of that is free for participants. Those costs add up quickly, and state law prohibits any state funding for the programs. Securing the funds from private donations and grants is the biggest reason there's not already a syringe exchange in Tippecanoe County.
It's been almost all funding. We already had our plan in place. We already knew what we wanted. The state approved our plan immediately. We never had to go back and forth on that, so everything has been funding.
But state funding isn't being addressed this legislative session. Before the election, Holcomb expressed tentative support for funding syringe exchanges through the state, but he now defers to a new statewide position he created, the Executive Director for Drug Prevention, Treatment, and Enforcement, Jim McClelland. McClelland fully supports the proposal to give county officials authority to establish a needle exchange, but he hasn't announced his position on state funding.
I have a laundry list of kind of like what I want this to look like. But I feel like this bill initially has moved in the right direction, and I think Governor Holcomb was very brave in his willingness to even state this needs to be brought down to a local level.
For Indiana News Desk, I'm Becca Costello.
House Bill 1438 has passed out of the House and now moves on to the Senate for discussion.